everyone, my name is Christina Gugino and I'm an OCD Massachusetts board member. Welcome to the first lecture of the 2014-2015 Les Brodberg Memorial OCD Lecture Series. Dr. Roberto Olivaria is a clinical instructor of psychology at Harvard Medical School and assistant psychologist here at McLean Hospital. He maintains a private psychotherapy practice in Lexington where he specializes in the treatment of body dysmorphic disorder, ADHD and OCD, and skin picking. He also specializes in the treatment of eating disorders in boys and men. In addition to his clinical work, Dr. Olivardia is an active researcher, has taught at UMass Boston and Boston College, and has presented at many talks and conferences around the country. Please join me in welcoming him here tonight.
Thank you all very much. So this is a topic actually that a lot of times when I give this talk, people are surprised that we would see OCD and ADHD together because people often think of them as sort of very opposite ends of the spectrum. So I'm going to start by first talking about what exactly ADHD is, because it's probably one of the most misunderstood conditions that are out there in terms of, and it's one of those sort of diagnoses that you sort of hear under the cultural rubric of, oh, I'm so ADD and all of that. So I'm going to talk a little bit to make sure that we all have a very solid understanding of what we're talking about with ADHD. So there are three different categories of ADHD symptoms. The first is inattention. And by that, we're not talking, the term attention deficit hyperactivity disorder is in a lot of ways a misnomer because people with ADD do not lack attention. They just lack attention when the stimuli is boring or uninteresting to them. Their attention is markedly lower and diminished than people without ADD. However, attention is often better, or what we call the hyperfocus, on stimuli that's very interesting to them. So when you have someone, or I might often have a parent that says, oh, I don't think my kid has ADD because he can play video games for 12 hours straight. That's often an indication he probably has ADD, that he can keep and sustain his attention. He's in a hyperfocus. People with ADD have, by nature, an under-aroused brain. That what we know from all the wonderful research on the brain and MRI scans is that the ADD brain is at baseline under-aroused. It has very low levels of dopamine, which is a neurotransmitter, a chemical messenger in our brain that is implicated with reward and motivation. So at baseline, if you have a bored brain, you're going to seek out things in your environment that are highly stimulating, that are highly interesting. And you need to more than somebody whose brain at baseline is not in that place. So as a result, many people with ADD are drawn to high stimulating activities. These are the people who you might see bungee jumping, who are in the mosh pit, or sometimes even things like conflict or drama are just very interesting and adrenaline seeking. People with ADD are easily distractible. They could be the daydreamers in class, miss parts of conversation because they're distracted. They might be looking out the window at the beehive out the window, as I did as a child in school. They have a hard time following directions. They can be forgetful. And they're individuals who often might start projects but have a hard time completing them. People with ADD are notorious procrastinators. And the reason for that is, again, neurologically based. It's something we call procrastination propulsion, which is that for someone with ADD, there are two time zones. There's the now and the not now. And so anything that I need to do next week is in the not now zone. I'm not thinking about it. It's not urgent enough. It's not creating enough of an adrenaline for me to pay attention to it. Once it gets into the now zone, it might be the night before the project's due, suddenly I'm starting to feel the adrenaline pumping. My brain is actually secreting higher levels of dopamine, which enables me to focus better. And I say me because I myself have ADHD, so I'm familiar with all of these concepts. And to people with ADD, the feeling of boredom is the most dysphoric feeling to them out there. It is horrific. People with ADD would rather be in chaos, would rather be stressed than to be bored if they had to pick one of the two. So a lot of times people with ADD, they might hear from loved ones, why are you always in the mix of the drama? Why are you always find yourself in these situations? And a lot of it is a sort of unconscious gravitation towards something that's not going to bore them. Second category is impulsivity. And by that, it could be a hyperverbal impulsivity. Kids with ADD or adults can often interrupt people because, for They might have a thought, for example, and instead of holding that thought till someone's finished, they almost blurt it out because they're afraid they're going to lose the thought. They can be very emotional, and so they can be very emotionally impulsive. Decisions, make very impulsive decisions, be quite impatient. And often, many of my ADD clients have impulse control issues in one of many areas. I work with people, one of my areas of specialty is in eating disorders. I see many people with ADD and binge eating disorder or bulimia, drug addiction, sexual addiction, pornography addiction, shopping, drugs, alcohol are often very, very big issues. So people with ADD are at high risk for one of many different impulse control issues. And the third is hyperactivity. Now, hyperactivity doesn't have to be in the mix. So we now call it ADHD. It used to be called ADD, attention deficit disorder, and that was the people who were not hyperactive, but were more the inattentive type. And then we had ADHD. Now it's actually all called ADHD, either inattentive type, hyperactive type, or combined type. And what we're finding is that there might be some differences between the two. For the most part, there's more similarities than differences. What we mean by hyperactivity is these are people who always feel on the go, as if there's a sort of motor inside of them. They have a hard time committing to things. They often might feel very suffocated or trapped because they're always looking for sort of the next thing. Always feel in motion or revved up. Very, very hard time. I mean, of course, where we often see ADD is in the classroom. But it doesn't mean that people with ADD can also succeed in school, which is one of the myths I'll talk about, that people with ADD are all bad students. But it is very hard for people with ADD to sit through long classes or lectures if it's not interesting, and always have a sense of restlessness. And that hyperactivity could also be a mental hyperactivity, which, as I'll talk about later, can make it confusing to understand what's OCD and what's ADD. That hyperactivity could be racing thoughts that are not anxious thoughts. Like I have a hard time going to sleep every night, not because I'm anxious, but because I'm thinking about the next book I want to write, or the movie I want to see next, or that great meal that I had, or what, and it's very hard for me to slow my brain down at the end of the night. Now, the positive features of what we also know about this kind of brain, there's also a number of studies that have looked at inventors and entrepreneurs and artists, and many of them who have ADHD, and find that that same kind of brain chemistry can lend itself to positive attributes, such as being a risk taker, as long as you're not too impulsive of a risk taker. People with ADD can be very good at multitasking, can be quite creative and entrepreneurial, and part of that is because they sort of think outside the box at normal, like it's often effortless for them to think that way. And that can not work in some settings when you need to think inside the box, and could work very well in other settings. Can often be socially charismatic, and often are people who are drawn to their passion because they have to be. It's very difficult for someone with ADD to work at a job that they don't enjoy. They would be dysfunctional. So the good thing about that is you're often going to be drawn to what you really love to do because you have to be. Now with OCD, as we all are familiar with the symptoms of the OCD, but we also know that there are certain personality characteristics that could be adaptive, provided that the OCD isn't rearing its head in terms of obstacles. Things like precision and detail orientation, being quite organized. People with OCD can have a good eye for visual detail and are often committed to the completion of projects. So, do we see, and why and how much do we see these two conditions combined? Now, there have been a number of studies that have looked at the comorbidity, or the co-occurrence of these two conditions, of ADHD and OCD. And studies range from 10% of people who are OCD who also have ADHD. But Dan Geller here at Mass General Hospital has done a number of studies, and he has done, I would say, the strongest methodologically sound studies, and he has found about a 30% comorbidity rate. So 30% of people with OCD also have ADHD, which can be shocking to a lot of people. Now, part of that also, as I'll talk about, is the ADHD can often be missed for many reasons. We also know that family history studies, when we look at even within immediate family, also show an association of OCD and ADD. So amongst my patients, for example, who might just have ADHD, they are more likely to have a family member with OCD than someone who does not have ADHD, and vice versa. So even when someone doesn't have both of them, you'll often find that within the family mix, you'll see each of these. So where does ADHD present itself most when we're talking about OCD? Where I see it most is in the pure obsessional individuals, or what I call pure O. So these are people who don't perform rituals or compulsions, but have a lot of mental rituals and mental obsessions. Hoarding. I did a talk actually for a conference of professional organizers a couple months ago, and the talk was about hoarding and distinguishing between people with OCD who are hoarders and people with ADHD who are hoarders. And they're a little bit different in a lot of ways. They can look the same, but actually have very different mechanisms. And people with ADHD are at very high risk for hoarding, particularly those who have an impulse control issue around shopping and sort of collecting things. Tics, Tourette's disorder. I work with a lot of patients who pick, who are skin pickers, and find a very high rate of ADD, as well as trichotillomania or hair pulling. So I find actually with a lot of the body-focused repetitive behaviors, nail biters, skin pickers, hair puller, picking at the skin, that there's a very high prevalence of ADD. So when we think about OCD, it's really not surprising to imagine this comorbidity, because one can almost conceptualize OCD as an attention disorder in many different ways. I mean, OCD is grouped as an anxiety disorder in the DSM, but if we look at it, it really has significant attentional issues. First, with OCD is you have an attention deficit for a lot of things except when it comes to threat-related stimuli. So there's a selective, almost zoning in of attention on anything that is regarded as a threat to someone with OCD. And often as a result of that, the things that are deemed not threatening are often sort of pushed aside. So for example, if you have contamination or germ phobias or issues, you're going to walk into a room and you may not even notice who's in the room, but you might look at how dirty the carpet is, you might see the cleanliness of the chairs to the exclusion of everything else. So your attention is not consistently across the room. People with OCD are unable to filter out irrelevant data, often due to a need for completeness or perfectionism. So when I work with a college student who has OCD and has perfectionism OCD, who is in a college class and literally feels like they have to write down every single word the professor says, you're not attending to the information. It comes to a point where you're just writing these words, and of course they can't keep up with that, and they completely lose focus of what's going on. Of course, obsessive thoughts with people who have mental obsessive thoughts, it's very difficult to filter out those thoughts. And when you're engaging in that kind of thinking, it's very difficult to pay full attention to what's going on in front of you in the present moment. People with OCD have difficulty with shifting sets. So they're individuals that might be more rattled by multitasking, are often individuals who like to see things sequentially through, from point A to point B to point C to point D. Which is very opposite to people with ADD, who can often find that very routine or too boring. People with OCD often have a very inflated sense of responsibility, which means that a lot of times their thoughts, for example, people who might have harming thoughts of, if I do this and this is going to harm someone else, they feel overly responsible for the health of somebody else. That sort of energy and all that cognition takes away from paying attention to things that they need to take care of, especially if you feel like you're responsible for other people or other things around you. What we know is that people with OCD also have cognitive deficits on certain visual memory tasks. So there's a neuropsych test called the Ray-Ostreit test, which is basically this funky Frank Lloyd Wright-looking house or design that you're presented with. You have to look at it for a certain amount of time, and then it's taken away from you, and you're asked to reproduce it. And most people, sort of people who don't have OCD, ADD, any significant issues, will draw the external outline of the house first and work their way from macro to micro. People with OCD often are the opposite. They will focus on the door and the doorknob and totally lose track of even the general shape of the house. So they might know what this one window looks like to its absolute detail, but they literally are not, they're losing the whole forest, but they get the tree. So we know that there's a lot of, so again, their attention is almost overly narrow to the exclusion of not taking in other things. So if you think of it in that way, OCD is an attention disorder in many different ways. So it's not unlikely then that you're going to now understand or see this comorbidity or this relationship. But at first glance, when we think about the characteristics, the stereotypical characteristics of people with ADD, people with OCD, they're very opposite in many ways. People with ADD are known for being spontaneous and love spontaneity. I do, for patients who with OCD or have social anxiety, I often do a lot of improv comedy techniques. I used to do improv acting many years ago. People with ADD love improv. It's like, there's no script, you're sort of going. It's very nerve-wracking for a lot of people who are anxious or people with OCD or social anxiety. They're more related to being planful. People with ADD are more impulsive. They might act before they think. People with OCD are more compulsive. They think a lot before they act. And as well as thinking, speaking. People with ADD sometimes are very unaware of social cues because of that impulsivity, where people with OCD might be too hyper-aware of certain social cues to the degree that they might not act or sort of be spontaneous. People with ADD are drawn towards being thrill-seeking and pleasure-seekers, and people with OCD are more anxiety avoiders. So their orientation to the world is a little bit different. People with ADD are like, what's going to stimulate me, what's going to make me feel good, and people with OCD are oriented with, what do I need to avoid to not be anxious? It's a very different sort of orientation. There's a fantastic book called Attention Deficit Disorder, A Different Perspective, written by Tom Hartman, Hartmann, one of my favorite authors in the ADD world, and he talked about ADD as being sort of this hunter mentality that years and years and years ago, you had the farmers who were the people who had to be very planful about their crops, who woke up when the sun came up, who went to bed when the sun went down, who led a very regimented lifestyle. Those were not the ADD folks. Those were probably more the OCD kind of folks who, and he said the ADD folks were more the hunters, the people who had crazy erratic sleep patterns, who needed to have a sense of vigilance to like catch the animal, who were nomads. And he said, so at one point, this genetic pool that we now call ADD or OCD could have been adaptive. And in a way now, where particularly with ADD, to sit in a classroom for 8 hours a day, personally, I don't think is very adaptive. I mean, that's like a new sort of invention in our evolution, if you think about it. So it's no wonder that you have these kids who have a very hard time being in school. Now, how could ADHD be missed when looking at OCD patients? First, primarily, ADHD is rarely assessed in clinical settings, believe it or not. That when I do consultations around the country for people, whether they have BDD or OCD or whatnot, when you look at sometimes the intake packets of a lot of programs that are for OCD and they screen for depression, whether you have a history of an eating disorder, substance abuse, and there's not one questionnaire on ADHD. And it's shocking to me. And part of it is because we think of ADHD as still a childhood phenomenon. Believe it or not, it wasn't until the mid-90s, we're talking only 10 years ago, that adult ADHD was sort of on the map by Ed Hallowell, who's here in Sudbury, wrote a book called Driven to Distraction, which is one of sort of the Bibles in the ADD world. And he basically said the most common sense thing, which is, well, where do you think it goes? I mean, you have it in childhood, it just doesn't disappear on your 18th birthday. Of course, it just manifests differently because you're not in school 8 hours a day. It's just going to show itself differently in your career or your relationships. So adults with ADD are often unrecognized, and particularly anyone who's over the age of 30 is even more so. In this generation, we're seeing ADHD being diagnosed quicker, and so you're seeing children that are being diagnosed with it in a way that 20 years ago, unless you had a conduct disorder or unless you were burning the school down, that's when you would be diagnosed with ADD. Growing up, when I look back, all my friends, we were all ADHD, but we had good social skills, we did decently enough in school, and we were mischievous, but we weren't like conduct disordered. But the friends of mine who were those kids, who I was friends with as well, they were the ones who were on Ritalin, but it was seen as like such like a, that those kids were bad behaved kids. ADHD and OCD symptoms can often intertwine, and what I mean by that is that sometimes it's very common for people with ADD, for example, especially when they're in a procrastinating mode, to often get very obsessive or compulsive about something else. So I can use my own experience, and every time before I wrote a paper, I went to Tufts for college, at Tufts, that I would procrastinate, and you always knew when I had a paper due because my room would be immaculate. Like, I would clean it, and my friends would joke and say, oh my gosh, you have OCD, you're so OCD, because I'd be Windexing the mirror, and all it was really procrastinating writing this paper, but I would just procrastinate very productively. But my room was not always clean. It's not like it was clean at any other time. It was almost like just a way of doing that. And a lot of times you'll sort of see those sort of symptoms correlate, where people who are trying to manage their ADD, whether it's procrastination, whether it's racing or distracting thoughts, by being almost overly obsessive with something as a way of grounding themselves. Most common quote I get for people who question whether they have ADD or their child has ADD is, he does well in school. Biggest myth, certainly having ADD can impact your academics. However, there are many people with ADD who do well in school, but I would tell you that they're not the same kind of students as people without ADD. So I did very well in school, but I procrastinated. I literally wrote papers overnight, last minute. I mean, things that people would take 3 weeks to do, I would do in 24 hours. And it was very stressful and very chaotic, but I pulled it off, and I had the energy to do it. And I don't know if that's a good thing, because I was sleep deprived and all that. So I wasn't the student that people thought I was, but I was a bright guy, and I knew what I had to do. So doing well in school doesn't mean you don't have ADHD. It's looking at, when I assess people for ADD, I ask them what kind of students they were, how they do their work. If it's a student that's like, oh yeah, I got that paper done 2 weeks ahead of time, probably not ADD. Versus the people that say, oh yeah, I get the papers done, but I'm doing them literally the last minute. He can focus for hours on video games. People with ADD can absolutely focus for hours if they're enjoying what they're doing. The lack of hyperactivity, people question whether it's ADD. And again, you can have ADD without the hyperactivity part. Patients or family often view ADHD as an excuse or a crutch. It's still seen as a bad diagnosis. It's amazing to me when I did talks around the country about ADHD, how people come to this and they said, oh my gosh, it's so good you have these conferences, because my son's school doesn't believe in ADHD, which is crazy to me. I don't know how you don't believe in something that's been clinically researched. ADHD behaviors may be labeled as resistant, and compulsions that might be more part of ADHD may be more part of ADHD than OCD. So for example, a lot of people with ADD might engage in sometimes very compulsive behaviors, like checking if they have their wallet or their phone, because they lose their wallet and their phone often. And if they don't check it many, many times, they're going to end up losing it. Very different than someone with OCD who has maybe never lost their phone, but they're compulsively checking it. So when I have a patient who will literally check whether he locked his car door, checks whether the key is out of the car, it's because one time he went into the mall and was walking towards his car, and he's like, oh my gosh, I lost my keys. Checked the entire mall, called security. 4 hours later, resigned to the fact, I'll just maybe have AAA, open the car, and it turns out his car keys were in his car, and his car was running for 4 hours while he was in the mall. He totally forgot to take them out of the car because he was so just looking forward to going Christmas shopping. So you never know. In other ways, the destructibility in terms of how ADHD can be missed in OCD patients, for people with OCD who can be fixated on certain thoughts, to be distracted can actually be seen as a positive. To have multiple certain thoughts can be a real good escape when you're fixated, particularly on tormenting mental obsessions. Patients have a lot of shame around ADHD. The hyperfocus that exists in ADHD can often be mistaken as being overfocused. And the difference between those two terms is, if you're hyperfocused, let's say if I'm reading a book, and a hyperfocus would be that I'm sitting with this book, and for 6 hours straight, I'm reading this book. I'm not even going to the bathroom, during that time. but I'm getting through, like I'm making movement, going through the book. But a building could fall next to me and I won't even hear it because I'm so focused on the book. Overfocus is, which you see more in OCD, is the person who's reading the book for 6 hours, but they're still on page like 1 or page 2. Like they're rereading, they're trying to perfectly understand what they're reading, so there's no motion, they're not getting through anything. They're like overly focused and stuck. So those are two different concepts, and a lot of times when ADD patients will talk about their hyperfocus, it can sound obsessive and often mistaken as being overfocused. The inattention can sometimes be looked at as being secondary to the OCD, which sometimes it is, but for people who really have ADHD, that people will think, well, yeah, of course it looks like this person has ADD because if they have obsessive thoughts, their compulsion to pay attention to everything, it's sort of going to be like an overload of their executive function system. Of course they could have attention issues, which can happen, but it's very important to make sure that is that truly what's happening, or is it that there is inattention that's separate from the OCD? Or the ADD can be labeled as obsessional anxiety. People with ADD can often come across as anxious. Their hyperactivity can look like anxiety when they're not really anxious, they're just revved up. Now, how could OCD be mistaken or missed in ADHD patients? And that happens a lot too. When I do talks at ADHD communities, I'm often talking about doing this talk, but educating them about OCD and helping them understand if there's OCD in the mix. Overfocusing can be mistaken as hyperfocus. So I'll have people with ADD that say, oh yeah, I have that hyperfocus, but I'm like just stuck on these pages. And I'm like, I don't know if that's hyperfocus. That might be more of an overfocus. People think, everyone with OCD is clean, that the popular notion of OCD is the cleanliness, contamination fear. Of course, we know there are many different versions of OCD, so you can be messy and have OCD. The focus can often be very reinforcing for a lot of ADHD patients who also have OCD. There's almost this there's a very interesting relationship for people who have both of these diagnoses that they talk about, that sometimes the focus of the OCD can feel very reinforcing and grounding if they feel so all over the place with their ADD. And as I mentioned before, the opposite is also true. The distractibility can be a welcome relief from being overly focused on a certain thing. There can be a lot of shame around OCD, and the unfinished projects that you might see in people with OCD because they're stuck can often be seen as a typical ADD thing of not following through on something. So I always mention when people have incomplete projects, you always want to have a sense of, okay, is it incomplete because they're like, okay, I'm bored with this, I'm going on to the next thing, which is typically an ADD thing. Or an OCD thing would be that they're just overly stuck, they're trying to get it so perfectly that the frustration level is so high, and they're not comfortable with the fact that it's incomplete. It's a very dysphoric feeling. For people with ADD, they've been there, done that, they're on to the next thing. There isn't that sort of bad feeling of like, oh, this thing is, like it really bothers them that it's incomplete because they have something else, a new toy or something to distract them with. So how is having both different from having either one, and what are the treatment implications or recommendations when people have both? So there's not that much research, surprisingly, and Dan Geller at MGH, I would have to say, has done most of the best studies, looking at groups of people who have OCD versus people who have OCD and ADHD, and finds that people who have both OCD and ADHD are more likely to have social problems, attention issues, aggressive behavior, externalizing scores, and externalization is more individuals who are emotionally expressive, can be impulsive, whether they're quick to anger, people with social phobia or social anxiety at a higher rate. Again, people with OCD and ADHD versus people with just OCD, you'll see that the people who have both OCD and ADD have lower social competence, lower school competence, lower internalizing scores, which means that they don't hold sort of things in as much. And the family cohesion is often more chaotic. That when you throw ADHD in the mix, the family system is a little bit more chaotic. Now, part of that also is that as we know with OCD, there are genetic correlates to OCD, that it's not a surprise when someone has OCD to learn that mom or dad or brother, sister, aunt, grandparent also has OCD. ADHD has an incredibly high genetic heritability. If you have ADHD, there's a 70% chance you'll have a child with ADHD. That's a very high heritability rate. With identical twins, it's about a 96 or to 98% rate. So if one twin has, an identical twin has ADHD, it's almost 100% that the other one will have ADHD. It's very highly genetic. So the family cohesion, part of it is the individual themselves who might be struggling, but also they most likely have a parent who also has ADHD and might be struggling in certain ways as well. And I should say that in terms of these two groups, there's no difference in the presentation of the OCD when you look at people who have both OCD and ADHD versus OCD. It's not that the OCD is necessarily worse or more severe. So now when you look at people with OCD and ADHD versus people with just OCD, that they find that people with OCD and ADHD are more likely to be male, have an earlier OCD onset. So the ADHD sort of pops out the OCD a little bit earlier, have lower rates of depression, which is interesting, that the ADHD actually almost mitigates depression. Now, one of the theories for that, as one of my patients once said to me, is that he's too distracted to be depressed, that once he feels depressed, he just gets stimulated by something else and it sort of ejects him out of a depression. Now, that's not always a good thing, only in the sense that sometimes we need to process our emotions and feelings in order to sort of understand something. And if we impulsively don't reflect on certain things, then we might not sort of resolve certain issues. So for example, if a friend is mad at you because you constantly interrupt them, and you sit with it and it makes you feel bad that your friend's mad at you, but then you quickly eject out of that because you're stimulated by something, then you're never really going to fully process, oh, my friend's mad at me because I'm interrupting them all the time and I should really work on that. People with OCD and ADHD have lower clinical improvement at 6-month follow-up. And then with OCD and ADHD versus just people with ADHD, higher attention problems, social phobia. And when I say earlier ADHD onset, what that really means is where the clinical symptoms are noticed more. ADHD is something that you are born with. It's not something you develop. It is genetically transmitted. I mean, so you are born into the world, and when you talk to parents with who have a child with ADHD, they'll tell you from moment one that in hindsight, they were the kids that never slept through the night, that were colicky, they were the kids like my own who never sat in circle time, that were always like running around, that you saw it from day one. But where it gets noticed most is in first grade, like once the kid is, in school. No difference in depression or anxiety or ADHD symptoms in these two groups, and the onset of OCD always precedes the onset of the OCD. Now, in terms of treatment studies, there are no empirical treatment studies that have really looked at this combined population of people with ADHD and OCD. So this is really kind of in its infancy, because again, we're starting with this notion that these two things are so opposite of each other that they're never really going to be seen together. So we need to first do more of those studies, but in addition, really try to have a sense of what do we do when people have both. Because unfortunately, there are a lot of treatment issues that can come from that. Now, there's one study in 2006 that found that OCD and ADHD subjects, so people who had both disorders, received mood stabilizers more frequently than people with OCD. The rate of patients with OCD responding to SSRIs are unaffected by an ADHD diagnosis. So SSRIs, which are the medication of choice for many people with OCD, are just as effective whether the person has ADHD or not. However, the medication of choice for ADHD are the stimulants, or amphetamine medications, things like Ritalin and Adderall, which often exacerbate OCD. Now, except the only time it doesn't do that is if the OCD is in many ways sort of secondary to the ADHD. What I mean by that is I've had many patients who have both issues, and their OCD only really triggers or pops out when their ADHD is not managed well. So when they, let's say, are sleep deprived because they're writing that paper overnight, and if they're very disorganized and very chaotic, then it's almost like their OCD kind of takes over because they feel so out of control that their OCD is searching for them to be in control. And in those cases, if we manage the ADHD, help the person with organization, with not being chaotic, with time management, their OCD doesn't present and rear its ugly head. So in those cases, stimulant medication actually can help the OCD. But if the OCD is unrelated to the ADHD, the stimulants make the OCD worse, particularly with a lot of mental obsessions. Now again, it's very tricky because I've had many patients in the past, for example, who only get into their mental obsessions when they're distracted. So if you're in a class and you're bored in the class and you're, instead of looking out the window, looking at what the kids outside are doing, you start getting in your head and your OCD, mental obsessions start taking over, then it's almost the distractibility we would like to work with the first to prevent the OCD from doing that. A lot of times though, it has nothing to do with the ADD. Those mental obsessions just take over whether you're, even in the midst of you doing the most important, interesting, stimulating thing, the OCD will do, rear its head. In those cases, stimulants will make it worse. They often make people more anxious. It's an amphetamine. Now, with people with ADHD, people wonder why are we giving amphetamines to people with ADD? But what they do is they don't make you hyper. They actually stimulate your frontal lobe, which is where all of our executive functions are. Things like time management and organization and planning and decision making is all sort of in that part of the brain. And that's what ADHD medication stimulates. It stimulates focus. With OCD, the SSRIs, people who have OCD, we find SSRIs are not helpful for people with ADHD, with the exception of Wellbutrin, which is an atypical SSRI. And Wellbutrin is also prescribed for people who are looking to quit smoking. It is an antidepressant, but it's actually been clinically indicated for ADHD. It doesn't work in the same way as things like Prozac and Lexapro and citalopram. So we find that for most of the SSRIs don't help, but Wellbutrin can be very helpful. Likely, people might need to combine if they want to be medicated for both of these conditions. That sometimes it's sort of really working with your psychiatrist at the dosage levels. And sometimes people will find with ADD that particularly students, I have many students who will take medication and then when they're not in school, they go off their stimulant medication because it might make their OCD worse. And that's perfectly doable. The good thing about stimulants is that you take it and within an hour, you're gonna feel it. It's gonna do its magic. And if you stop taking it, it washes out of your system pretty quickly and that's it. So it's pretty fast acting. Now having ADHD also adversely impacts cognitive behavioral therapy and behavioral therapy for people with OCD. And I can tell you a little bit more how to do that. So in terms of treatment, when I work with people who have both, first of course is awareness of understanding both of these conditions and getting a proper diagnosis and understanding how they each work. It can be very intricate to really understand, okay, what is the ADD, what is the OCD, what is the ADHD sort of, when is it ADHD, when is it OCD? So if I'm being perfectionistic about writing a paper, is that OCD because I'm trying to be perfect and I'm just getting stuck on a word? Or is it ADHD because I can't organize my thoughts in a linear sequential way? 50% of people with ADHD also have a learning disability. Of that 50%, 80% are dyslexic, and the other 20% are what we have dyscalculia, which is a mathematics disability, which I definitely would have qualified for, or dysgraphia, a handwriting issue. You'll find like fine motor skills. People with ADD often have deficits in fine motor skills, buttoning buttons. The game Operation was like a hellish game for me. I don't know who would ever play that game. Just every time I hit anything, I'm like, I'll never be a surgeon. So learning disabilities are very prevalent. So for people with ADHD, you should always assess for a learning disability. So that's even more reason, especially for academics, to always be aware. There's another disability called disorder of written expression, which refers to people who have a very difficult time writing their thoughts onto paper. And that can often be mistaken as OCD, when in fact it could be a learning disability. So people who have their ideas in their head of writing a paper, but they sit in front of a computer and they just are frozen. They just don't know how to put their ideas on paper. And these are all in the group of learning disabilities. So anyone with ADHD, always assessed for a learning disability. Acceptance of both of these disorders, cognitive behavioral therapy, which I'll talk a little bit more about, social skills training, health behaviors. It cannot be overemphasized how important proper eating, sleep, and exercise are for, for anybody, but particularly for this group. People with ADD in particular are known for having very poor sleep habits, which obviously is going to not do wonders on your attention or your focus or your OCD. Poor sleep will exacerbate OCD symptoms. Poor eating exacerbates OCD symptoms. So all of these things are very, very helpful. And the treatment really needs to be in some ways through an ADHD lens. And why I say that is because the person's baseline, even with the OCD, is often going to be through sort of some of these characteristics of having ADHD, and understanding that is going to be important. For example, and this is sort of exposure and response prevention, which is the behavioral treatment of choice for people with OCD, is that coaching is essential for motivation and accountability. For people with ADHD, it is even more essential. In the ADHD community, it's very common, like ADHD coaches are a very common phenomenon for people who need to get their dissertations done, for people to have a coach and having what we call it, having an account buddy. And a lot of times I find that people with OCD, after a while of doing certain coaching, they're expected to do, let's say, exposures in a self-directed way. If you have ADHD, you're going to need more of that coaching before you can do a self-directed, because it could be all the intention. ADHD is known as a disorder of intention. People with ADD know what they need to do, but they don't always do what they know. And that's a good example. So if I have someone, I'm like, hey, tonight I want you to do the self-directed ERP. Okay, they're ready, 7 o'clock, they're planned. The next day or the next time I meet with them, they say, oh, I didn't get to it because I was going to, and then I forgot, and then my friend called me, and I went out, and then I came home at midnight, and then I just completely forgot about it. So it's not that he was resistant to it, it's that his impulsivity made it difficult. So he needs more of that coaching and structure. I often find, too, that when doing the hierarchy, so let's say someone who has contamination concerns, you might start with having them shake your hand, and then you work through touching a dirty shoe, and then you work up to touching a dirty toilet. I find that people who have OCD and ADHD, I always start at a higher rung on the ladder. And the reason for that was actually a patient when I was on my internship at the OCDI, the OCD Institute, and it was a patient who clearly had ADHD. I don't think he was actually diagnosed with it, but it was very clear when he had ADHD. And he had his hands on a trash barrel, and he looked perfectly calm. And this is something that should make him a little bit more anxious, considering his sort of history. And I said, are you focusing on the fact that you're touching like a dirty barrel? He's like, actually I'm not. He's like, I'm thinking about my summer vacation. I went to Italy and it was really nice and the food was really good. And he's like talking about, and I'm like, oh, so in his mind, he's completely disconnected from the fact that his hands are on this barrel. And so what I found was when I work with patients, if you bump them up to almost like a higher rung where it's almost impossible for them to be distracted by because they're so connected to the fact that they're anxious, they're connected to their anxiety. So people, again, with ADHD can get distracted out of these sort of emotions, even when they're in the face of these situations, which on some level can be adaptive. But in the case of treatment, you want them to feel anxious in order to then habituate to the anxiety. The other thing is, again, self-directed ERP. When I have a patient that's doing a self-directed, it's more than, okay, tonight at 7 o'clock, I'll say to them, I want you to email me at 7 o'clock, or right now on your phone, let's set a reminder for you, so it's 7 o'clock, and then I want you to email me right after you do the self-directed exposure. That kind of accountability works really well for people with ADD. And oftentimes, either the patient with ADD or family members or other treaters might think that they're being sort of infantilized in some ways, or they're being overly accommodated. That's what they need. I tell parents who have kids with ADHD that they need that sort of structure, and they might need that person sitting next to them while they're doing their homework. Otherwise, they're not going to get it done. So it's not coddling them. It's exactly what they need to do. For treatment-wise, people with ADHD and OCD versus just people with OCD are more likely to miss sessions or be late. And it's not, your question? I'm almost done, and then we can ask questions. Yeah. You'll find that people are late, and not because they don't respect my time, or not because they don't even respect, it's because they get focused, they're right out the door, and they think, oh, let me quickly send that email, and then they send an email, and oh, okay, I forgot I didn't fill up my gas tank, it's empty right now, and before you know it, they're 20 minutes late. And I get that. I understand that they're not being rude, they're not being disrespectful. Unfortunately, many people aren't going to understand that. And so that could become an issue. I'm very well aware when I'm working with anyone with ADD and people with OCD, even those who don't have ADD, about whether their inattentiveness is even happening in session. Are they ritualizing in session, or are they distracted in the session? So I check in throughout the session. Are you with me? Maybe we should stand up, let's stretch, sometimes I switch seats with patients. They sit in my chair, I sit on the couch, just to sort of create some novelty. The other thing that happens is a whack-a-mole phenomenon, where sometimes when OCD symptoms decrease, the ADHD symptoms pop up, and then vice versa. So sometimes you won't see them occur or present at the same time, but you might see sort of one dominate, and with the OCD, I've seen this many times, the OCD gets better, and then suddenly the disorganization, the executive function issues increase. So I'm going to quickly go through this, because I want to have at least 10 minutes, because I know we end right at 8. The other thing I see is in terms of careers, that people who have both OCD and ADHD often get in these career dilemmas, where people with OCD have a very high need for control, and people with ADHD often have very low executive functioning skills in terms of things like time management and organization. So when you have both of those characteristics, I'd say it's like needing to be the driver but having a very bad sense of direction. It can be a very difficult conundrum to sort of be in and to find the right sort of jobs. I work with a lot of adults who are in this situation. So total control can conflict with demands that don't always play to people's strengths with ADD. And so it's very important to be aware of trying to find a job that has some flexibility but structure as well, what I call flexible structure. So a predictable job but not a redundant job. Like I have a predictable job. I know I'm going to come in and every hour I'm going to meet with somebody, but it's not redundant. I'm not meeting with the same person every hour. Every day I work different hours. So if it's too structured, these individuals get bored, but if it's too unstructured, they're going to be completely unproductive. So there's that middle ground. So I just pay a little bit notice to that. And then quickly, always assess for people with OCD. I say always assess for ADHD. There's a lot of neurological findings that are looking at abnormal brain flow and trying to have blood flow in terms of trying to understand how people can have both. Of course, we need greater sample sizes and twin studies. And another thing, just briefly, about how we see it genetically. One theory is what we call non-random mating, which is that people with ADHD tend to marry people who are more on the OCD spectrum, and vice versa. So you sort of see this yin-yang going on, and as a result, genetically, their children now have this genetic pool of both OCD and ADHD characteristics. And that's one of the theories as to why we see them together. And it makes sense, because people, if you're someone, and people with OCD are often attracted to people who are more like ADD, who are more spontaneous and more fun and more like not people who are as anxious as they are. And so you sort of see that balance, and that could be one of the reasons that we sort of see this pool. So I'm going to end there, and we have 10 minutes for questions. You want to start?
I've got, I just wanted to look at your thoughts talking about the people who need the accountability.
Yes.
You sit with them and say, you know, do work, do work.
Right.
Is that enabling to the OCD that?
That's a good question. So with the accountability, it's a very fine line of making sure you're not enabling the OCD, but at the same time, you're honoring the ADD part, right, that they need that accountability. So as long as you're not, you don't have to be like reassuring somebody, for example, but you might need to, be with them, or like with my patients, I say, email me before, email me after. I might sometimes shoot them an email, say, okay, did you do your exposure yet? And I'm not, that's not enabling the OCD. Sometimes people feel it can be overly accommodating or infantilizing, but that's what's needed. So as long as you're not reassuring them or sort of accommodating the OCD, but it is sort of providing, it's almost like you become the accountability that internally they don't naturally have yet. It takes longer time for them to develop that. Yep.
Have there been any studies, particularly with very, very high functioning people, very high IQ or very creative, to then add in the OCD and ADHD components which are them, and then look at the whole totality, see if therapies, particularly pharmaceuticals, have a net effect on decreasing that rare creativity or that rare abilities that go with a much higher IQ, and that therefore it's better to tolerate the OCD and ADHD than in any way jeopardize, the image of the eccentric scientist.
Sure. Very good question. And I know in the ADD community, that's a very common concern or issues, because you'll see, like, there's a study, I think the London School of Economics found that like 2/3 of Fortune 500 CEOs are ADHD and dyslexic. So there's something about that kind of chemistry when you're thinking outside the box, and a lot of them don't take medication. I remember like David Neeleman, who used to be the CEO, and he was the founder of JetBlue Airways. He has ADHD, he has 9 children, I think 7 of them have ADHD and or dyslexia, and he was afraid, he didn't want to take medication for that reason. Now, many patients, their creativity is not stunted at all. If anything, their creativity can thrive because they can actually focus to bring that creativity to fruition. For other people, they don't like the medication because it focuses them too much and doesn't allow them to kind of get into sort of places that they otherwise would get into. In terms of your question about studies, there aren't any empirical studies that have really looked at that. But there are studies that looked at, in the ADD community, they call it twice exceptional, is a term they use for people who have very high IQs or are gifted, but also have ADHD or executive functioning issues. And there's little research that's just looking at how they might be, different. But it's very, I would say, 50-50 in terms of how people look at medication. Yep.
Some of your lectures, especially the second half, seem to be tending towards the pediatric role. Especially when you're talking about having an encounter buddy and someone sitting next to you doing homework. My behavioral therapist is telling me that he's in this place where he's known me for years, but now he's thinking, when you get really focused on something and maybe sometimes you're not spiraling now, because he's getting really into something like that. You can do that because it's hard for you to do anything different. And I'm wondering, is this home-based therapies and such like that can feel maybe embarrassingly needy? And I'm just wondering, is this a pediatrical kind of approach you're taking, or
Not at all.
Not at all.
No, it could be with adults as well. Absolutely.
I have the same question too.
Sure, with adults, I have ADD patients that bring their bills into session, and we go through their bills. And this is the thing, I think so much of it, as far as ADHD is concerned, it can feel very shaming to people who have ADD, particularly, many of my patients are particularly bright, and so, but with ADHD, it's those routine things that are the things that are the biggest obstacles. It's like getting the bills paid, it's getting to sleep every night, it's eating 3 times a day. It's like the things that are effortless for many people. And so it can be very shaming. I work with CEOs who run these multi-million-dollar companies, manage hundreds of people, and I'm going through like a food shopping list with them, because if they don't write a shopping list, they buy everything they shouldn't be eating and then come home with like junk food and not one vegetable,
Well, they can't do it by themselves at home, you send someone over there.
I've sometimes done that, or we, food shop, or they'll, again, call me when they leave the supermarket, and there's a high degree of accountability.
And the second question was, what you were saying about the 2 branches of attention, one of them being too bored, the other one being too distracted. It just struck me that any of that seemed to fit. Do you know that the person who the book called Flow,
Yes, I'm familiar. I haven't read it.
It just seems like it might fit into that paradigm of anxiety and boredom being the 2 similar for this. At the same time, you're caught between anxiety and you have to be right where you need to be for stimulation,
Yes.
but you can't be too far ahead of yourself with the problem of too much anxiety.
Absolutely, and a very common concern, I mean, for people with ADD is like, you know, they say yes to a lot of different projects and overcommit themselves a lot and feel this like stress and chaos. And then when you work with the to-do, and I see this in myself, when the to-do list starts going down, I'm just saying yes to other things almost because I'm anticipating, oh my gosh, shoot, I'll have nothing to do, you know, and I need to have something to do. That's the ADHD. But then the OCD can also commit to things like I feel a responsibility for this or a perfectionism. And so it can be very tough to sort of tease apart. Yes?
I have a question.
Sure.
So I'm actually at the OCDI right now.
Mm-hmm.
And it's kind of funny that you mentioned, like, for ERP, it can take longer to feel anxious due to, like, some distractibility.
Yeah.
The past few days, I've been wondering why I haven't been felt anxious in some of the exposures. Like, is that because of, like, when it happens, I'm like, oh, I must be doing something wrong, or, like, I'm not really, like, it's so confusing. I don't know if I'm distracted or, you know what I mean? Like,
Yeah.
I don't know.
It could be. I mean, I think that definitely talk to your behavioral therapist about that as to whether are you, because the purpose of exposure therapy is you're supposed to do everything that, in a way, when you're not doing that, you're trying to avoid. In exposure, you're supposed to think of everything about what you're doing and how anxiety-provoking it is. So if you're touching a dirty toilet, you're supposed to think of the urine and the people who have done what they did and the fact that you're touching it and the fact that it's on your hand. You want to be thinking, you know, that. You want to be connected to that thought. And so sometimes it might be harder, those thoughts might not be as sticky if somebody is distracted, if they're not focused on that. And that doesn't necessarily mean you have ADD. It could be just an inability, or it could be difficult to sort of focus on that, or an anxiety about. Sometimes people with OCD could have problems with exposure because they're worrying whether they're doing the exposure perfectly.
Yeah, I think that's my issue.
That's more of an OCD thing. So that's sort of like, am I doing this right? Am I doing this perfectly? That could interfere with your ability to really connect and be present. So that's a good example of where there's an attention deficit that's OCD related versus ADD related. Versus if you were telling me like, oh yeah, the whole time I'm thinking about, you know, this movie I saw, which is a really great movie, and and that's more of an ADD thing. But you're still anxious, but you're not anxious about the actual exposure. You're anxious about whether you're doing the exposure correctly. You know what I mean? Which is something still you should work on with your BT, because it means it's still interfering with your ability to actually do the exposure. Yes, but actually, let me put it on.
Is there a particular resource or resources you recommend to help with finding assistant finding a job that's flexible and not the particular places to go or to read? That's a hard one.
It is a hard one, yeah.
If you come across that.
There isn't. I mean, what I just tell people is to be very. This is why the assessment is so important about being very well aware of like what kind of person you are. Like when I work with students, I'm always talking about like what kind of student are you when you're applying to colleges, when you apply to a job. Like what do you know about yourself? Like I know I could never work in like a cubicle. I would be asleep in 5 minutes if I was working in a cubicle. I'm a very verbal person. I have an older brother, and it's interesting. He's ADHD as well, but his ADD is very different than mine. He works in a cubicle in a bank. And that's how he focuses. He would be too distracted by too much busyness. I'm addicted to the busyness. He's the opposite. So it's really just understanding like, okay, there's this part of me that likes the structure, the routine, but there's this other part of me that might be too bored. So how do I, you know, and it's almost like trying to look at career by career and see how you can nurture. And which is, you know, what's the balance? You know, what's tolerable? Because of course there are parts of my job that are going to be boring. I hate the paperwork and all of that. You have to do it. So how do I understand that that's what I need to do the things that I really enjoy about what I do? Unfortunately, it's 8 o'clock and I know we have to end right on time, but please email me if you have any, Alana, do you want to say?
Yes.
Sure.
So I just wanted to share about an OCD support group, which is on Facebook. It is completely unsearchable. Your friends would never be able to tell that you're in it. You can literally not even find it unless someone from the group adds you.
There are about 90 people in it right now, many OCDI graduates, but also people who have not gone through the OCDI. But it's just a really good aftercare resource, and in terms of like if you are in the OCDI or anything, because just keeping with those skills, you can be accountable on it by like saying you're going to do this exposure and stuff like that. So I just want to like open that up if anyone would like to be interested in learning more or want to be added to this.
Thank you. Thank you all, and please email me if you have any further questions.